I'm an old soul, got a funky sound. Gonna sing a song, turn the world around.
Hello everybody, Dr. Vasquez here. Right now I'm going to do part 2 of my 2024 review, which is happening right now, of my 2013 presentation. And as I said before, the reasons that I'm doing this are, first of all, because I've never seen my own presentation. And the reason for the review is because I want to advance my information on brain nutrition, so to speak. And the most efficient way for me to move forward with that, of course, is to review what I've already done. So I'm reviewing what I've done before and updating it with a few comments. So, for example, rather than just post the video, which I could do and which I have done, I think what's more useful is for me to actually give some commentary and critique of my own presentation in light of what's new or providing more explanation. So as I did in the first part of this review, I'm providing a bit more detail because, you know, in the time that I did this conference presentation, some of these ideas weren't fully developed and some of them still are not fully developed, but at least I can explain more. Anytime, you know, we do conference presentations, we always have time limitations and things like that. So, you know, sometimes we can barely mention something and then we have to move on. Whereas what I'd like to do right now, when appropriate, is provide a bit more detail on things that I just barely mentioned in the conference. So what I did in the first part of this review is I made it up to about 34 minutes, and that leaves another 39 minutes in this presentation that I'd like to review right now. And so I'm just going to let the video play, and then when necessary, I'll stop the video and say, you know, this is right, this is wrong, or now we have new information, or now we can go a bit farther with these ideas. So the point that we had gotten to in the first part of this review was up to this section right now, kind of on metabolism and ketone bodies and mitochondrial function. And so obviously that's where I'm going to restart the video with a slight amount of overlap. This section is actually quite important because of the role of mitochondria in brain function. And the common cliche, which is commonly used when people talk about this, is very accurate. So I'm going to go ahead and use the cliche, even though it's a little bit tired. But if you think of the brain as an organ sitting in your skull, that represents about 3% of your body weight. But the brain, in terms of metabolic demand, represents about 25% of oxygen and metabolite consumption. So you've got a 3% by weight organ consuming 25% of your, you know, metabolic resources. So the brain is very energy dependent and mitochondria dependent. And so, you know, if we were talking about skin or tendons or your spleen or something like that, you know, the role of mitochondria would be relevant, but not hyper relevant. Based on what we know now, among other things that we know, any conversation that we have on brain health has to include conversation on mitochondrial performance. And so that's why I've allowed about 2 or 3 minutes of overlap, just to make sure that what I say here is clear and reasonably complete. So again, this conference seminar was in 2013, and I had already published a few articles by that time on mitochondrial health and the importance of mitochondrial function versus mitochondrial dysfunction. Since that time, especially in 2016, I wrote much more information about brain and mitochondria, and in 2016 I published a peer-reviewed correspondence in a top-tier journal called Nature Reviews Rheumatology, mentioning, you know, the role of mitochondrial function in neuroinflammation and chronic pain. And then the following year, in 2017, I also published another brief correspondence in the Annals of the New York Academy of Sciences, talking about the gut microbiome and how that affects brain function, especially as relevant for autism. And I'm assuming, without having looked at it recently, but I'm assuming I hopefully mention something about mitochondria there, because in autism, for example, those patients, mostly kids, but those patients with autism typically have an overgrowth of certain bacteria that I've listed in that article and in some other publications. They have a gut overgrowth of certain bacteria that produce a short chain fatty acid called propionic acid. And propionic acid is directly neurotoxic, and it causes mitochondrial dysfunction. So that's part of the role that it plays in the chronic neuroinflammation of autism. So going back to this presentation, as you can see on my orienting table on my left-hand side, I talk about major interventions: diet, vitamins, minerals, fatty acids, amino acids, botanicals, and additional interventions. I hope that I cover all of that in the next 39 minutes. I don't know if I succeeded in that or what, but hopefully I did talk about it. And if not, then I'll try to fill in some of the gaps as we go through this right now. So without too much further ado, I'll dive into this. I'm going to drink some tea in the background while the video is playing. And hopefully things will go well. My wonderful wife just painted the basement earlier this afternoon, and so right now the place is kind of a little bit of chemical smell, even though I'm somewhat protected from that because I closed all the doors I could. But right now the whole house smells like Pasadena, Texas. And if you're not familiar with Pasadena, Texas, just imagine the Chernobyl radiation disaster, except instead of radiation, it's chemical smells like from all the petroleum industries. So that's kind of what's going on in the background of my mind. But I'll try to ignore that while I get through this video review. So here we go. I'm going to play the video. I'll try not to talk over it. But again, if I need to explain something or advance the conversation a bit, then I'll pause the video.
I mean, I think that's pretty cool, right? So, I'm all about speed, as you already know. So, I like things that work now in real time. I don't want to wait 6 months for an antidepressant to work, right? I want my people happy now. So, let's avoid sugar and get happy. Influence of diet and exercise on mental health through hormesis. And I believe, again, it was probably Deanna and David who both said this. You have to stress the brain. I mean, how do we perceive people who are intelligent? What's the defining characteristic? That they come up with good ideas, they perceive reality accurately, they're adaptable to situations. So it's mostly about neuronal flexibility. Well, the way to ensure that your neurons and your whole nervous system remains flexible is to challenge it, right? So not eating and then going to exercise, your brain and your body has to develop adaptive response to that, right? So that's why we don't want to go overboard, for example, with antioxidants. We've all talked about antioxidants, but antioxidants actually blunt the physiologic adaptation to exercise. So we have to stress the body and then refuel and repair it, and then that's what leads ultimately to Anti-Fragility, which is a book that some of you may have heard of, right? Anybody heard of that book, Anti-Fragile? Pretty interesting. And he actually talks about medicine. He said, the way we practice medicine makes people fragile, and then we make them dependent on us, meaning the medical system. Really nice quote. So phytonutrient density is what we're aiming for because we want all those phytonutrients, like Deanna was saying earlier. We want lots of color, and we want variety among that color. So when we put a plant-based diet together, that's as many phytonutrients as we can get. Obviously, people can juice. They can eat dark chocolate, right? One of my personal favorites. In fact, I just did it about an hour ago. So cocoa flavonols and brain perfusion, basically they cause a anti-inflammatory effect, an antioxidant effect, induce production of nitric oxide because one of our speakers also said, right, the vasculature wants to be constricted. So it's an active process to get those vessels to open up. So we have to encourage them to do that, and obviously this is one of the ways that we can do that with bioflavonoids and polyphenolics and phytonutrients. So, clinical implementation, plant-based diet, fruits, vegetables, nuts, seeds, berries, adequate protein, flavonoid-rich foods like cocoa, tea, coffee, should be red wine up there, fruit and vegetable juices, and obviously they can use concentrates, supplements, and specific supplements like ginkgo biloba, for example, which has a lot of good research behind it. Berry fruit supplementation in the aging brain, same summary here. Let's look at this study. So some controversy has been promulgated, as the word is, that kids may or may not have sensitivity and attention deficit disorder after they eat artificial colors and flavors and preservatives. So this study, relatively recent from the Lancet 2007, showed that when kids eat chemicals in their food, they have a brain response which can lead to the misdiagnosis of attention deficit hyperactivity disorder. So I realize for some reason there's controversy about it, but there shouldn't be, right? The controversy shouldn't be about getting kids away from these foods. The controversy should be, why would we ever expose our kids to these foreign chemicals anyway? Like, that's what requires justification. Similarly with genetically modified foods. So here's my conclusion from this one. Avoiding chemicals is safer than consuming them, right? Clinical application of common sense. No medical justification exists for allowing patients to consume unnecessary colorants and chemicals, right? So you have to look at diet as you would a prescription. Like, would you prescribe your patient to go eat junk food? Obviously not. Here's another article correlating what they called, they had their own abbreviation for this, nutrient biomarker patterns. What correlates with improved cognition as people get older and improved mood is vitamin sufficiency and omega-3 fatty acids. Great. How do we do that? Vitamin sufficiency and omega-3 fatty acids? How about a paleo diet with some supplements? Right? It doesn't have to be heroic. Let's see what that was. Anti-inflammatory diet, I've only got 5 slides on this. We've already talked about it. Anti-inflammatory effect of low-carbohydrate diet. People need vitamin supplements. We talked about that. When we give them vitamin supplements, it reduces inflammation. When we give them some extra vitamin D, that also reduces inflammation. So we can reduce inflammation, low-carb diet, multivitamin, multimineral, extra vitamin D. The first 3 components of my 5-part nutrition plan. So why would we want to do that for the brain? It's because the brain can receive peripheral cytokines and inflammatory markers, and those inflammatory markers alter neuronal function, and therefore alter cognitive function and emotional stability as well. So when people are inflamed, it's not just that their joints are inflamed or their tissues are inflamed. Those cytokines are crossing the blood-brain barrier and affecting neuropsychiatric and sociologic function, right? So anytime you do a C-reactor protein or an ESR or an anti-nuclear antibodies or CCP or any of those other markers, you've got to understand that when you're looking at those inflammatory markers, you can use that as a surrogate marker for some level of brain impairment. Exercise builds brain health, key roles, growth factor cascades, and inflammation. So exercise has an anti-inflammatory effect, and when you stress your body through exercise, your body has to adapt, right? So your body, your vasculature, and your muscle tissues secrete growth factors. Some of those growth factors cross the brain, and they promote neurogenesis, right? So that's the simple and accurate model for how that works in real time. So let's acknowledge the power of simple nutritional interventions. So let's look at this. Influence of supplementary vitamins, minerals, and essential fatty acids on the antisocial behavior of young adult prisoners. So all they did is give these young adult prisoners multivitamin, multimineral, and some combination fatty acids. And look at the conclusion here. So what they showed were fewer offenses, a reduction in the number of offenses and aberrant behavior. Conclusions: antisocial behavior in prisons, including violence, are reduced by vitamins, minerals, essential fatty acids, with similar implications for those eating poor diets in the community. Right? This is the supplement outline that they used. Again, you'll get this in the notes. But my point in showing this is that these are ultra low doses. So we're not even in the high dose potency. These are almost like homeopathic doses of vitamins here. You know? Like, for example, look at the dose on their, well, you can't really see it. Sorry about that. Look at the dose on their B12, if you could see it. I'll just read it to you. I think it was 3 micrograms. Yeah, it was 3 micrograms. And the dose on B6 was 1.6 milligrams. And how about magnesium? 30 milligrams. These are practically homeopathic doses of vitamins, and it still produced clinically significant results, right? Treatment of mood, liability, and explosive rage with minerals and vitamins, 2 case studies in children. This is from Journal of Child and Adolescent Psychopharmacology. So these were two boys who had behavioral abnormalities. They were treated with very simple nutritional supplementation. They both had remarkable improvement in their condition. What if they hadn't been treated? So that's just one path. That was one option that the practitioner took. What if they hadn't been treated with vitamins? What would have happened? Well, this one had obsessive compulsive disorder, and this one had pervasive developmental delay. So would they have been medicated? Absolutely. Would they have had to go through like years of, social adaptation therapy? Of course. What are the side effects of the antidepressant drugs? Feeling worse, suicidal ideation, suicidal completion, right? All these kids needed was some extra nutrition. So here's an article, again, substantiating the connection between improved nutrition and improved mental health. You'll get the citation in the summary tomorrow. Vitamin mineral supplementation on juvenile delinquency among American school children. You'll get this tomorrow and you can read the abstract. Again, the take-home message is very low-dose nutritional supplementation alleviates juvenile delinquency. Maybe we do the same thing for adult delinquency too. And just the abnormal patterns of behavior I think that we see throughout society these days. Improved mood and behavior during treatment with vitamin mineral supplement. Open case series, you'll get that one tomorrow. My point is, simple nutritional interventions often help people a lot. And I do want to emphasize, and I'll give you a quick case of a patient I worked with a couple years ago who responded minimally or not at all to low-dose supplementation. And then I said, we have to pull out all the stops and go for it, and that's when he responded. So this was a approximately 50-year-old man with metabolic syndrome, hypertension, abdominal obesity, and congestive heart failure. And I'm trying to make sure I get the right patient in my mind. His main complaint was severe depression, and he was treated with electroconvulsive therapy, and he was treated with polypharmacy, which is standard of care, but he still wasn't responding. So I started treating him with nutrition. I did my usual protocol, and we didn't get a spectacular result. Not hugely surprised necessarily, but I'll tell you what changed his life and what changed the course of his condition. I had him on about 3,000 milligrams of EPA and DHA, and I was expecting some improvement. We weren't seeing the improvement that we wanted, so I was aware of the research showing that we could go as high as 13. I want to make sure I get my numbers right. 13 grams a day of fish oil, which is basically what we ended up doing with him. So in terms of volume, that's about a quarter or about a third of a cup of fish oil per day. It's a lot of fish oil, right? But it's safe according to the research, so we're hitting the triad or quadrad of evidence-based medicine, and that's what changed his life, was high-dose fish oil. So his daughter came back about 2 or 3 weeks later to refresh his supplement supply, and she said, I want to thank you for giving me my father back. Right? So when low dose didn't do the job, high dose did the job, and it did it very quickly because we had to force those fatty acids into his brain. So this is, I believe we're about to get into a really awesome topic. So David Haase earlier talked a little bit about cerebral folate deficiency, so let's extend that a bit here and see what other nutrients that could apply to. So people can have normal levels of nutrients in their body and be brain deficient in certain nutrients. That's the major point here. It probably happens with many or perhaps all nutrients, but the ones we're going to focus on right now are B12, folic acid, and iron. So what this research showed, again, you'll get it tomorrow, some people have a blood-brain barrier defect that blocks the efficient transmission of nutrients from the blood into their brain. So if you measure nutrients in their blood, it'll be normal. If you were to measure them in their cerebrospinal fluid, which most of us aren't going to do on an outpatient basis, you would find their nutrient levels in their brain to be low. Well, what do you do with that as a clinician? You're not going to do CSF puncture on all your patients just to see if they have this nutritional deficiency. So what do? Ignore it or just treat empirically? Right? I would just treat empirically. So what this article documents, and maybe I'll just read the last line, some patients have high serum B12 and low normal CSF concentrations, which could be explained by blood-brain barrier transport defect. So let's look at some more examples of that. here's a great article, and this is another one you can get online for free. This is an article that's definitely worth having. What this article states is that the tests that we use for B12 deficiency, like serum B12, methylmalonic acid, homocysteine, et cetera, he says in this conclusion, and this was published by the American Society of Hematology, what he says in this article, he says those tests are basically worthless. I think most of us would say they're probably not completely worthless, but you know what he recommends? What he recommends is that if you think a patient is nutrient deficient, and he's talking specifically about B12, if you think a patient is B12 deficient, simply give them B12. You don't have to document it, just give them B12. What does a methylmalonic acid test cost these days? $80 or $100, right? How much does a B12 supplement cost? $10? How many patients ever got healthier from receiving a lab test? Right? That's a real question because, you know, we all want to take action. We have a patient in front of us. We want to take action. We want to, you know, implement Nietzsche's will to power and things like that. We want to feel good about ourselves. But doing a lab test is only gratification for the doctor most of the time, or a lot of the time, right? Your patient doesn't really care that much about lab tests as much as they would care about getting better. So why do a $100 lab test when you can give them a $10 supplement and get the answer retrospectively based on their response to treatment? Right? If they get better, you got your diagnosis. So how much B12 would you give them, in what form, and by what route? Might as well talk about it now, right? Somebody asked me, and I said we'd talk about this today. So what are our options? We can go oral, or we can go parenteral, meaning injection. We can go IV, we can go subcutaneous, or we can go intramuscular. So, and we've got 4 different forms of B12 that we could use, right? Cyanocobalamin, hydroxycobalamin, methylcobalamin, and adenosylcobalamin. So what are we going to do with all those variables? I'll tell you what I do for the sake of speed. That is, I give them hydroxycobalamin orally at least 2,000 micrograms per day. The research is very strong on that giving relatively high dose oral, and that is considered high dose oral supplementation, but in my hands I now consider that low dose. So usually I use like 6,000 micrograms per day. And I like hydroxycobalamin. Obviously, we're not going to ever use cyanocobalamin unless we absolutely have to, right? Why? Because it contains cyanide, right? What is cyanide? A mitochondrial poison. Anybody want to give your patient a mitochondrial poison while you're telling them it's going to make them better? Let's try to avoid doing that. Sometimes we have to. Why is cyanocobalamin even on the market? The answer is it's cheap. But if we can use hydroxycobalamin, methylcobalamin, or adenosylcobalamin, I think that's better. The thing I like about hydroxycobalamin in particular is that it binds on and chelates toxic substances. So you get a supra or meta-nutritional effect by using the vitamin in that form. So the toxic substances that are chelated or bound or detoxified by hydroxycobalamin are sulfite, which is a mitochondrial poison that we'll talk about tomorrow, hydrogen sulfide, which is a mitochondrial poison that we'll talk about tomorrow, nitric oxide, which some people produce in excess, and I believe that's it. I think there's actually one more, but I'm pulling up 3 right now. So you can bind those and detoxify sulfite, hydrogen sulfide, and, oh, the other one is cyanide, so there was a 4th one. So when people have cyanide toxicity or exposure, you can detoxify them simply by using hydroxycobalamin. That's true for cyanide, it's true for hydrogen sulfide, and it's also true for sulfite, but we don't see too much sulfite poisoning as much as we do cyanide and hydrogen sulfide. So briefly, that's what I do. Let's talk about B12. Let's look at a few cases. Catatonia and other psychiatric symptoms with B12 deficiency. So this was a woman who was 52 years old. She had been a vegetarian or vegan, and she started to basically neurologically deteriorate. You'll see this in your notes tomorrow. You can Google this article and get it. It's available for free online. Catatonia and other psychiatric symptoms with B12 deficiency. So you can get this article online for free if you just Google it. But basically, she started to just disintegrate. She became stuporous. She had to get electroconvulsive therapy, right? she had to get electroconvulsive therapy because she had a nutritional deficiency, right? Crying spells, marked anxiety, odd motor movements. They gave her B12. She bounced out of it within a couple days. Same thing here, catatonia, another neuropsychiatric presentation of B12 deficiency. And look, this patient had normal blood parameters on a CBC test, right? So what I was told, and most of you who went through medical school were probably told the same thing, what I was told by one of my attending physicians, if there's no anemia, the patient can't be B12 deficient, right? That is totally wrong. Lots of patients are B12 deficient and they're not anemic. It's because the deficiency affects their CSF in their brain first, and through various mechanisms, most of which are well established, for example, the fact that they could have folate excess while they have B12 deficiency, they won't be anemic. What clinical picture would produce what I just said? Folate excess with B12 deficiency. Bacterial overgrowth of the small bowel. So when people have bacterial overgrowth of the small bowel, the bacteria produce proteases which block the efficient absorption of B12, so they become B12 deficient, but those same bacteria produce folic acid or folic acid analogs that block the anemia and can actually raise their blood folate levels. So they have B12 deficiency, folate excess, and what happens when people have B12 deficiency that doesn't get diagnosed and treated within 6 months? Permanent brain damage, right? So brain damage starts to set in and starts to become irreversible at about 6 months.